Thank you. Now, everybody remembers their first sex ed class, the awkward side glances trying to avoid eye contact, and the painful silences in a room full of awkward preteens. Now, everyone who's had these classes knows about the risks of STDs, but the fact is that none of them really registered that it could happen to them. The fact is that STDs pose a serious threat to anyone who's sexually active. And the most notorious and deadly of these diseases is the human immunodeficiency virus, or more commonly known as HIV. HIV, the precursor to the autoimmune deficiency syndrome, or AIDS, has been a part of our culture since the early 1900s. But as of 2013, it's claimed the lives of over 1.2 million people in the United States alone. Not only this, but AIDS has been credited with killing over 700,000 people in the past 20 years alone. And those are just the documented cases. The fact is that we can't ignore this disease any longer, not when it has such a terrifying grip on the community. Now, you may be asking yourself, Taggert, how exactly does this disease function? What about it makes it so lethal? Well, to start with, HIV needs a host cell to function and survive. In essence, HIV infects the cell, hijacks the cell machinery, and then uses that machinery to reproduce its own genome. Much like a Bond villain uses a stolen money printer to produce fake currency. Now, when HIV is done with the cell, the virus particles leave and it essentially destroys the cell in the process, which is exactly what makes the disease so lethal. Now, like all viruses, HIV has a certain type of target cell. However, in the case of HIV attacks immune system cells. Now, immune cells are supposed to be the cells that are attacking HIV in the first place. So in infecting those cells, HIV renders the host incapable of defending against it. So, not only does HIV hijack cell processes and attack immune system cells, but another thing that makes it so lethal is its ability to mutate so quickly that doctors can't find a cure for it. Now, this mutation, while it may seem small at first, can cause big repercussions in the field of searching for any cure, just because a simple chromosomal abnormality can change the entire way that the disease functions. Most of these mutations will eventually cause the cell to die because they're defects in the chromosomes. But if that mutation has some sort of advantage for the HIV virus, then the cell will continue to propagate and replicate and reproduce that advantage over and over in all of its following lineages. It's that kind of mutation which poses a problem for making any vaccines, because if an HIV virus grants a resistance to any sort of antibiotic we may put into the system, then that just throws any chances of using that antibiotic right out. So, in the end, it would take too long to produce a vaccine against HIV because, 1, HIV reproduces rapidly and is hard to track normally, and 2, every reproduction, HIV accumulates more and more mutations. So, in a sense, it's very hard to find a vaccine that will attack a single stage of HIV development. Now, the funny little thing about HIV is that HIV doesn't actually kill the patient, per se. Its primary function is to hinder the immune system and cause a decrease in the amount of T cells. What usually ends up killing an HIV or AIDS-affected patient is a secondary infection that comes along and abuses that decreased immune system to run rampant through the body. Once the second infection takes hold, it's very hard to stop it without an immune system. Now, as intimidating as HIV sounds, there have been people who have been known to survive with HIV without presenting the full AIDS symptoms. One notorious legend of such is former LA Lakers point guard, Magic Johnson. However, cases like his tend to be an anomaly. In fact, for the first 15 years of HIV's presence in America, the disease was uniformly fatal and there was no real treatment for it until about the late 1920s, when antiretroviral therapies were introduced to make living with HIV possible. So, now we have the means of prolonging the lives of someone afflicted with HIV. However, to this date, the only way of combating the spread of this disease is through simple prevention. And by that I mean the screening of sexually active adults from age 15 to 65. Now, as it just so happens, the CDC just released an article last year promoting every single public and private health clinic to screen all of its patients, both adult and teenager, for HIV, so as to promote HIV awareness and to prevent its spread. Now, obviously, prevention is the best way to stop the spread of HIV, but prevention does nothing for those who've already contracted the disease. As such, the primary focus in healthcare is to increase life expectancy and the quality of life in all patients afflicted with HIV. Now, one of the most effective treatments for reducing the symptoms of HIV is simple diet and exercise. Now, this may seem like a very obvious answer and one that you hear for almost every ailment that you ever get, but the fact is that it works. I mean, it's very simple. Treating your body right will help prolong its durability. As a matter of fact, patients who suffer from HIV are much more likely to contract cardiovascular diseases such as hypertension and diabetes. And a healthy diet and exercise can help prolong their susceptibility to these. It can also help slow the progression of the disease. Another important aspect to consider is that because most HIV-related deaths result from secondary infection, getting vaccinated is very important to maintaining a positive and healthy lifestyle when living with HIV. You see, getting vaccinated helps lower one's risk of getting secondary infections such as colds or flus or measles or anything like that. And it's those that wreak havoc on the body, especially in a compromised immune system such as those infected with HIV. As you can see, although prevention is very good at helping control the spread of HIV, the real kicker is trying to promote a happy and healthy lifestyle in those that are already afflicted with the disease. That's why in 2014, there was an international forum on HIV and rehabilitation research that had over 92 representatives from across the globe. And its sole purpose was to assess the threat rate of HIV spread and address possible courses of action in regards to its high infection rates. The end result of this conference concluded that the medical field's research on HIV must be directed at more long-term treatments for HIV, and that this research should be funded and promoted in countries like the UK and Canada, resource-rich countries that can help combat the raised infection rates in both Africa and the United States. As such, new treatments and long-term treatments are in higher demand and more prevalent than ever before. Now, the most modern treatment method for HIV is antiretroviral therapy. And since HIV is a retrovirus, or a virus that integrates itself into host DNA, it's very difficult to treat because of its inseparability from the host genome. As such, despite all the progress that we've made in the past 30 years within the field of antiretroviral therapy, the most we've succeeded at is making the disease at most manageable. Now, given this slow progress, several organizations have introduced several research projects on HIV-dependent host cofactors, or to put it more plainly, the HIV virus's partners in crime. These projects hope to hinder the HIV virus's ability to reproduce and duplicate in an effort to prevent its further infection of the host. However, the problem with these is that these antiretroviral therapies fail to address the main problem by which any HIV treatment faces, and that's the fact that HIV integrates itself within the host genome. It becomes a part of the host, kind of like a steel beam being accidentally welded to the foundation of a building. As such, new therapeutic techniques that target HIV's integration into the host genome pose a possible hope for a cure. I mean, think about it. These treatments are the future of medicine because at the core of every single disease there's an underlying genetic factor. Every person's body responds to different treatments differently, and every person's body likes certain treatments better. It's just the fact of life. Your genome predicts how you react to certain treatments. And if we can personalize those treatments, well, then we've reached the basis of the future of medicine. Now, if you were to take an average human being and compare him to another human being, they'd have approximately 1% of a genetic difference between the two. But that 1% attributes to a vastly different genetic preference towards any modern treatment that's out on the market today. In fact, approximately 30% of over-the-counter treatments that are prescribed will have no effect on a certain individual simply because of their genetic profile. And it's because of this that we're pursuing the next generation of treatment, and that's personalized gene therapy. Now, personalized gene therapy is the most ideal treatment because it allows us to provide our own prescriptions based on your genetic profile that'll have the most effective way to treat you and specifically only you. Now, the way personalized gene therapy works is that we take a small sample of blood or tissue and run it for your DNA. Then, we sequence that DNA for little fragments that more freely associate with the HIV virus. Then, we take those fragments, place them on a microchip, and then treat that microchip with a variety of drugs to see which ones affect the fragments better than others. Now, this is the first step towards filtering out all the bad drugs that won't more efficiently treat the disease. Next, we culture those cells which have those fragments of DNA and treat them with the drugs that we isolated earlier. And use the electron microscope and other analytic tools to determine the correct dosage to give. And there you go. You have your personalized gene therapy. As you can see, personalized gene therapy is a great way to maintain cost effectiveness while treating the disease fully. Now, despite its benefits, personalized gene therapy does come with some controversy. Because at its core, personalized gene therapy is based off the fact that you're giving somebody else, some medical practitioner, a full look at your medical history, a look at your genetic profile. And for some people, that can feel like a breach of privacy. Now, it's up to those who are afflicted with a serious disease, such as HIV, that require personalized gene therapy, to decide whether those costs outweigh the benefits. Now, once again, I'd like to thank you all for listening to our personalized gene therapy and HIV Tag Talk. Once again, I'm Taggert George, and this is Tag Talks.